Good morning. I'm Dr. Don, and I'm doing some interviews this morning with several of our intensive care unit nurses to better understand why they chose the nursing field and what advice they might give to someone considering the nursing field. Obviously, most of what we do in the hospital, we can't do without nurses. They're an essential part of the healthcare team, the largest part of the healthcare team, really. And they tend to be underappreciated many times and work long hours and don't always get paid as well as they should given the time investment. But we need more nurses. All of us sooner or later are going to need nursing care if you live long enough. And having good nurses is such a bonus that it's important to get people that are in nursing for the right reason. So I thought I would interview people that are at the top of their profession doing critical care nursing to get a better idea of what their individual stories are that led them to become nurses. So I'm here with Reka. What is your job here?
I'm a registered nurse.
Okay. And how long have you been in nursing?
Almost 18 years.
Okay. And how did you come into being a nurse? What happened?
Okay. When I was young, my mother basically, she's a nurse. She was a nurse.
Uh-huh.
So I got, in our family, so we always talk about nursing. But we didn't had money to go for the education or anything. So my uncle and aunt, they were here in the States. So they paid for us and they put us on the college. And they helped me to come up with the nursing. And
where were you living at that time?
I was in India.
India. Okay.
Yeah.
And is nursing something you just sort of thought of all along because of your mom, or what was motivating
because
you?
I was staying beside the government medical college in India, and it's so big. Whenever I pass by, I can see the nurses are going with the white dress, and everybody respects them. The way when we are getting into the hospital, everybody is scared of the nurses, and I didn't think that it's not like this.
Really?
But yeah, it was so interesting to see.
Could you ever imagine yourself doing anything else?
I have to.
Yeah.
I like teaching also, but at the same time, the nursing. When I get into the nursing, I understood that it's more interesting because I am very talkative and I like to communicate with the people. I'm encountering with the different kinds of people and different culture, different experiences. So it makes a lot of difference in my life.
So if you knew somebody who was thinking about going into nursing, what would your advice be?
Hey, go for it. Don't wait. No second option. Go for it.
All right.
Yeah. In my family, basically, we are around 6 people are nurses.
Oh, great.
Yeah.
All right. Well, thank you very much.
You're welcome.
So how long have you been doing nursing?
I've been a nurse for 10 months.
10 months?
Yes.
Wow.
I'm a new grad.
So what led to this? How did you wind up in nursing school?
So both of my parents were doctors in my country. So I've always been kind of like involved in the medical field. I've always loved like the science behind it and like behind the body and the whole pathophysiology behind things. And I was like, what better way to get involved and also directly help people, because I'm very into like holistic care, like caring for the emotional side of people as well. So I was like, being a nurse combines both of them, so it was the perfect like.
And where were you from?
Venezuela.
Oh, okay. And is this something you had thought about all your life, or did something happen, or was there a mentor or something like that that put you into this?
So actually, I wanted to go into like the vet field at first, like more into like the animal sides of things.
Mm-hmm.
And my best friend's father had got lung cancer, and he passed away in 2019. And she told me all about like how great the nurses were and how they like changed her whole perspective into the grieving process and all that stuff. And that's kind of where I made the switch, like, that's what I want to do. I want to help people that way,
Oh, great. And what advice would you give to somebody else that was considering the nursing field? What should they expect from the experience?
It's a lot of work, especially in critical care. I feel like the learning curve is just 90-degree wall. It hits you right in the face, but it's so rewarding to see the most critical patients that are able to make it out. So it's just give yourself grace and give yourself time, and it's all hard work, but it definitely pays off.
Okay, well, great. Well, thank you very much.
You're welcome.
So we're here with Lauren. Tell me about how you wound up in nursing.
Sure. When I've always known I wanted to do something medical related. I just didn't exactly know what that meant. But in high school, I enjoyed well-rounded subjects. I liked math, science, also social sciences, art, and I thought nursing was a good combination of all of those subjects. And then also my dad did a career change while I was in high school, so he was in nursing school at that time, so that also influenced me to choose nursing. I think it's a career that has a huge amount of opportunities, just a ton of diverse opportunities, and you get to help people every day.
How long have you been a nurse?
Just almost 2.5 years.
Okay, so you're still in the learning process. I think it's safe to say all the good nurses never stop learning,
That's fair.
because what you learned in school gets obsolete so quickly.
Yeah,
Everything changes. We learn the new real.
you go into a new
So what
unit, learn all the different things with that.
so what kind of advice would you give somebody that was considering the nursing field?
It's a good question. Just to try new things, and even if you don't find one aspect interesting, or there's always something new. Like you said, there's always new learning. There's just don't be afraid to try different things.
Did you start out in intensive care, or were you working in some other unit?
Yeah, I started in med-surg and orthopedics, then I went to the emergency room, and then to the ICU.
Okay. All right. Well, thank you very much.
Yeah.
All right. So we're here with two of our experienced ICU nurses. So
Rosie
Rosie
and V for
and
short.
V. Okay. So tell me what got you into nursing? How'd that happen?
So growing up, my mom worked in a nursing home. I saw my brother go to nursing school, and my grandmother got sick. She actually got cancer, and she was. I saw how the oncology nurses treated her, so when I became a nurse, I went straight into oncology, and I had a passion for that and love it, and I still love my oncology patients. So that's what motivated me.
How long have you been a nurse?
8 years.
And how long have you been in intensive care?
The past, I would say 4 years.
And what advice would you give to somebody who is looking at a career in nursing, possibly?
I would say that it's one of the best decisions I made. I feel like when I go home that I feel like I've done something, that I've made someone's day either easier, or that, that I feel fulfilled, like I'm spreading joy.
So you're not just here for the money.
No, if you do it for the money, that's
It's the wrong.
it's going to be the wrong thing, because you're going to feel like you still have a void. You have to have a passion for it, because it's a hard job.
And how about you?
Well, it's by accident, actually. I didn't realize I was going to become a nurse. My father was a cook in the hospital, and he always had, it was very interesting. He always let us, at the time, he would take me to the hospital, and my fear of the hospital setting was kind of like dulled. A lot of times people come into the hospital when they're very, very sick, and they're very scared. And one of my biggest passions is making them feel comfortable even when they're sick in the hospital. And I always picture myself as a patient, and how would I want to take care of somebody who's scared. So that's why I approach people as if this is something, even though it's taken them away from their normal lives, it's a temporary thing. It's not scary. It's something that being ill is part of the human condition, but we're hoping to get you back home in the safest way possible. And even though, it's a very scary thing, that learning about what's going on with you is something that is difficult, but it's also manageable. And we're hoping to make sure that people get home as soon as they can.
And what advice would you give as a mentor to somebody considering nursing?
it is the same thing. It's scary at first, but if you work hard and you're consistent, you can do it.
Great, thank you.
You're welcome.
So there you have it, the inside scoop on why you become a nurse and what is good about being in nursing and what kind of passion it takes to get into this field and how rewarding the work can be. If you have interest in this, please leave comments below. If you have additional questions or other job fields you'd like to see interviewed in the hospital, I can probably find some other people willing to talk about how they wound up in hospital work. Personally, I've been working in the hospital since I was 18 years old, so that's a long time. I started as a respiratory therapy assistant, a respiratory therapy technician, a respiratory therapist, a neonatal respiratory therapist, a respiratory therapy supervisor, and then later as a medical student, a internal medicine resident, a pulmonary fellow, and a pulmonary and critical care physician to this day. So I've had a lot of these jobs in the hospital and learned something at every step. Until next time, don't forget to subscribe to the channel, share the video to people you think might be interested, and hit that like button as that helps the YouTube algorithm distribute the video more widely. See you later.